Welcome back, everybody. Today we are going to explore Chapter 9 of Exploring Medical Language and discuss terms related to obstetrics and neonatology. Hopefully this picture looks familiar after learning about the female reproductive system last week. We've got the uterus here in the center, the ovaries on either side, and the uterine tubes, also known as the fallopian tubes. Throughout the course of 2 weeks, an egg is going to mature in the ovary, and then it's ovulated, where it then enters the uterine tube. These fimbria are beating to sort of pull the egg up into the uterine tube. If intercourse has occurred and there is sperm within the female reproductive system, then fertilization of the egg typically takes place in this outer 1/3 of the uterine tube. An ectopic pregnancy occurs when the egg is fertilized but does not enter the uterine tube and instead implants outside of the uterus in the abdomen. That can be an emergency surgical situation. So the fertilized egg is going to then travel down the uterine tube, and while this is happening over a couple of days, the single cell of the fertilized egg is going to start dividing and divide into multicell zygote. The zygote then enters the uterus and implants into the wall of the endometrium, where it then can establish a blood supply and nourish growth. Once the zygote has implanted, we have the establishment of the placenta, which is going to allow for nourishment of the fetus. And you can see the umbilical cord attaches to the placenta, and the placenta attaches around the top of the uterus. There is a condition we'll see later called placenta previa, where the placenta is attached down at the bottom over the cervix, and that is not a safe place for it to attach. Here are some examples of combining forms that are used in obstetrics and neonatology. So amnio or amniano refers to amniotic fluid, which is the fluid that surrounds the fetus in utero. Feti or feto both relate to the fetus. So notice that you can use the I or the O, depending on the term, as the combining vowel. Lacto refers to milk production, and omphalo refers to the umbilicus or the navel. Some additional combining forms include cephalo, which means pertaining to the head, episio, which means pertaining to the vulva, such as in an episiotomy, which we'll see in a few slides. Primi means first. Pyloro refers to the pylorus of the stomach, where the stomach connects into the intestines. And terado is literally translated as monster. However, in terms containing terado relating to obstetrics, terado refers to malformations or abnormal development, such as birth defects. We have some new prefixes in this chapter. Ante means before. Multi means multiple. Hopefully everybody can get that one. Nulli means zero or none. Post means after, and pre means before. We have a few new suffixes as well. Saesis means relating to pregnancy. Genic is originating or causing. Rhexis is the rupture of. Stenosis is a narrowing. And tosha means birth or labor. Let's look at some disease and disorder terms for obstetrics. So we have a couple terms built from word parts used that involve amniotic fluid. So oligohydramnios is scanty amniotic fluid or not enough, less than expected amniotic fluid. Polyhydramnios is when there is more than the expected amount of amniotic fluid. Terms that are not built from word parts that involve the placenta include abruptio placentae, which is premature separation of the placenta from the uterine wall. It's also called placental abruption. And placenta previa, which I discussed a few slides ago, which is where the placenta is attached down inferiorly over the top of the cervix. So when that happens, that is risky for the pregnancy and often requires the mom to be on bed rest, and it often also requires a C-section for delivery. Some diseases and disorders that pertain to the neonate include terms built from word parts that involve the umbilicus, like omphalitis, which is inflammation of the umbilicus, or omphalocele, which is herniation of the umbilicus. And then some terms not built from word parts that involve congenital abnormalities or birth defects include cleft lip or palate, where the two sides of the lip or the two sides of the hard palate do not come together in the midline. Coarctation of the aorta is when there is a stenosis or narrowing of the aortic arch, making blood supply to the body more challenging. Esophageal atresia is a congenital absence of part of the esophagus, which means that you cannot get food from the mouth into the stomach. Gastroschisis is where there is a fissure of the abdominal wall that is not at the umbilicus. So this usually presents with protrusion of the intestines on the outside of the abdomen. And spina bifida is where the posterior elements of the spine do not come together. So the lamina and the spinous process are either missing or they don't unite in the back. So there is an opening in the posterior aspect of the spine, which sometimes the spinal cord can herniate out of, but it really limits the protection of the spinal cord and can be dangerous, although there are multiple different levels of spina bifida. Some surgical terms. We have amniotomy, which is a rupturing of the amniotic sac during labor. Often the amniotic sac will rupture on its own, but if it doesn't, then sometimes the obstetrician or the midwife has to rupture it so that the baby can be born. An episiotomy is a cutting of the vulva, at the vaginal opening to increase the size of the vaginal opening to allow for the passage of a baby if it's too tight. Cervical cerclage is stitching the cervix closed to prevent dilation and premature delivery. So if the cervix is opening too soon, sometimes they will sew it shut in this cervical cerclage procedure. Cesarean section is cutting through the abdomen to remove the infant through the abdomen of the mother. And in vitro fertilization is when a sperm and an egg are combined in the lab. In vitro means in the lab or outside the body. So they're combined, creating the embryo in the lab, and then the embryo is transferred directly into the uterus. Some diagnostic terms. Amniocentesis is the removal of fluid, of amniotic fluid, through a hole in the abdomen. So a large needle is pierced through the abdomen into the amniotic sac, and amniotic fluid is removed and examined. The APGAR score is a score that they give every infant upon its birth. It was developed in 1952 by Virginia Apgar, who was a doctor, and it provides a basic framework for rapid neonatal assessment by a healthcare provider. It's done at 1 minute after birth and 5 minutes after birth. There are 5 criteria that are looked at, including heart rate, respiration, muscle tone, response to stimulation, and color of the infant. They're all assessed on a score of 0 to 2 scale. So the score is totaled with a 5-minute APGAR score of 7 to 10, considered normal. This is used for quickly reporting the neonate status and does not predict future health outcomes of the infant. Chorionic villus sampling, or CVS, is a sample of the blood supply taken from the placenta. This can be done at 12 to 13 weeks to look for chromosomal abnormalities. Nuchal translucency screening is an ultrasound screen of the back of the fetal neck, looking for extra fluid or thickening, which can usually it's done between 11 and 13 weeks, and a positive test can indicate some fetal abnormalities. Pelvic sonography is an ultrasound through the abdominal wall, and then quad screen is a blood test during the second trimester, which tests for 4 different hormones that often will increase with some of the more major birth defects. Here are some obstetric complementary terms that are built from word parts. Amniorrhea is the leaking of amniotic fluid. Multipara is a woman who has had more than one pregnancy, resulting in viable offspring. Nullipara is when there have been no pregnancies, resulting in viable offspring. Primigravida is a woman who is pregnant for the first time. And puerperal means pertaining to childbirth. So which of these terms describes a sign or symptom instead of describing the adult status in regard to pregnancy and birth? Correct. Amniorrhea, the leaking of amniotic fluid, is a sign. The use of gravida and para in medical shorthand can be confusing at first, but it's a very specific way that everything is written. So let's look at this. A 27-year-old G4P2113 is a woman who has had 4 pregnancies, so gravida 4, and then para of 2 term births, so carried to full term, 1 preterm birth, so gave birth before full term, 1 abortion, and has 3 living children. Some complementary terms not built from word parts include cephalic presentation, which is the head down, head coming out of the vagina first, which is the ideal scenario for giving birth. Colostrum is the first product that the breasts will create to feed the baby before the actual milk comes in. It's a very high protein product that's excellent for those first few days of life. In vitro, like I stated before, means outside the body or in the lab. A midwife is a provider who is typically a certified nurse. Usually we have certified nurse midwives these days who can aid with childbirth. So you can have a midwife instead of an obstetrician. Midwives can attend home births as well as hospital births, and often are less inclined to use interventions than obstetricians. And last, we have parturition, which is the act of giving birth. We're going to have a quick spelling lesson. So there are 2 ways to spell the word breech, breech with an E and breech with an A. If we are talking about a breech presentation or a breech baby, we are breech with an E. So breech baby is a baby who is not head down, but instead presents with either their buttocks, their feet, or their knees emerging first through the vaginal canal. Sometimes you can give birth to a breech baby. It's much more difficult. So oftentimes these days, if you're working with an obstetrician, they will do a C-section. Breech with an A is a term referring to the failure to observe a law, conduct, or agreement. So as in breach of contract. So breech with an A is a legal term. Breech with an E is a medical term. Neonatology complementary terms include congenital anomaly, which is a birth defect. That's the medical term for birth defect. Meconium is the first stool that's passed by a newborn. Typically, it's after birth. Sometimes it will happen during the birth process, so there may be ingestion of meconium, which needs to be suctioned out after birth. A neonatologist is a doctor who specializes in the care of newborn babies, especially those who are premature or have health issues. Stillborn is a baby who is born and is not alive or has no heartbeat. And a teratogen is a substance that can increase the likelihood of birth defects, so increasing the risk to the baby. And last, we've got some abbreviations. FAS stands for fetal alcohol syndrome. LMP, if you work in obstetrics or gynecology, you will see LMP every single day. That means last menstrual period. PRIMIP means primipara or first pregnancy. RDS is respiratory distress syndrome. And a VBAC, which is said just like I did, it's not VBAC, it's pronounced as a word. VBAC is a vaginal birth after cesarean. So that's when a woman has had a cesarean, a C-section, and then in a subsequent pregnancy, she attempts a vaginal delivery. So thanks for joining me today to talk about obstetrics and neonatology. I'll see you back next time for our discussion of the cardiovascular system.